would be no.
Okay, you're good.
Hi, I'm David Bruce with the Erie Times News, and this is Breanna Adams with the Erie County Health Department. And we're going to talk today about ticks and Lyme disease. We also have Sarah Grabsky from the Erie Times News. She is behind the camera, and she's going to let us know if there's anybody out there who has questions about ticks or Lyme disease. She'll be able to voice those questions or comments, and we'll also be able to answer those. So let's get started. Breanna, thank you very much for being here today.
Thank you for being here yourself, and for all of you for being here as well.
Absolutely. Kind of let's start at the beginning. Why have ticks become, over the last 30 years, a public health concern? Ticks have been around for a long time, but there's a lot of medical and public health concern about them. Why is that?
There is. We're seeing deer ticks all around Erie County, and they're carrying diseases. So Lyme disease, Pennsylvania is the top state in the United States with the most cases of Lyme disease every year. That's why we are really focusing on ticks, making people aware of them, making sure that they know what they look like, how to remove them, and where they can find them to keep people safe, disease-free, and able to enjoy the outdoors all the time.
Now, ticks have not always had Lyme disease. They are carriers of Lyme disease, correct? How do they acquire the Lyme disease, and how do they transmit it?
Sure. So when a tick is born in its nymphal stage, it doesn't have Lyme disease at that point, but it picks it up by feeding on a carrier, such as a white-footed mouse. So when there's a high mouse population, the ticks will feed on the mice, and then they could pick up the bacteria at that point that causes Lyme disease and carry it through the rest of their life.
And they do feed on humans as well, correct?
They will, yes.
Okay. Let's talk a little bit about Lyme disease. Folks are probably out there have heard of Lyme disease. Some of you probably know quite a bit about Lyme disease. Let's talk about how it affects people and what type of disease it is. What can you tell me about Lyme disease?
Sure. So Lyme disease is caused by a bacteria, and that bacteria is held in the gut of a tick if they're carrying it. When they bite, after they're attached for about 24 hours, then the risk of transmission would rise, and that bacteria then could infect the person, making them ill. And the first symptoms they would get are flu-like symptoms. So achy joints, fatigue, just kind of all over not feeling well as they might get a rash in a bullseye shape. It could be around the site of the bite or anywhere on the body.
And it can happen on their scalp. Sometimes it can be very hard to tell, right?
Right, yeah. The places that ticks like to really bite are the dark and warm places. So your armpits or your belt line area around your scalp. So not places that we're always looking or searching for small bites or rashes at that point.
And not everybody gets a bullseye rash, right? I mean, so there is some concern because a lot of the symptoms are flu-like symptoms, and we've seen a lot of flu this past winter.
Yes.
But you have the bullseye rash. Not everyone gets it. And then if you don't get, well, what's the treatment for Lyme disease? What should people do if they think they have Lyme disease and they have these symptoms?
If they're presenting with any of these symptoms, if you know that you were bit by a tick or you're actively outdoors pretty frequently, the best recommendation would be to see your doctor for antibiotic treatment.
And that's in the acute phase of Lyme disease. If you're not treated, sometimes, but not always, right, the symptoms go away. I mean, they tend to disappear. The Lyme disease is still in your body, but sometimes you don't always have the symptoms over time, correct?
The Lyme bacteria would stay in your body, but the symptoms could change too. Sometimes if you don't get treated with Lyme disease right away, then later symptoms include Bell's palsy, where part of your face or part of your body would start to become paralyzed and kind of droop, or arthritis, more so in one of your joints than another. So like one of your knees might be arthritic while the other one wouldn't. It could also lead to cardiac problems as well.
So very serious health problems. The initial health problems with Lyme disease are very much like flu plus the rash. It responds well to antibiotics at that stage, but if you're not treated, it can come back and cause very chronic and life-threatening health problems, correct? And I think we do have a question from someone out there.
A commenter named Christine. How soon should antibiotics be taken with respect to the date of the bite?
Well, we're getting into some medical questions, and this is a good point to talk. Breanna works for the health department. She is not on the medical side of this. She is on the environmental health science side of this. So we are going to talk a little bit about the basics of Lyme disease and stuff like that, but I want to caution that Breanna's not a nurse or a physician, so we're going to not get too much into the medical side. There will be a story in the Erie Times News where I do interview a physician here in town about Lyme disease. I'll have a little bit more in that story on the medical side. Breanna, can you tell me a little bit about what you feel comfortable with on the medical side?
Yeah, so normally those first types of symptoms, the flu-like symptoms, would present in about 7 to 10 days. And if you're starting to feel like that, I would be recommended to visit a doctor.
And that could be your primary care physician, correct? Your
Absolutely.
Family doctor, someone like that. And especially the physicians around here are seeing more patients with Lyme disease. That kind of leads to another question. The health department keeps track of the number of Lyme disease diagnoses in Erie County. That number's gone up a lot in the last couple of years.
It has.
Are there theories? Do health department officials have theories about why the numbers have gone up, especially in 2016 and 2017?
The theories are really just that people are more aware of ticks and Lyme disease. They're asking their doctors, hey, I am outside, I am seeing ticks all over, maybe I have Lyme disease. Other ideas are that as people have spread out of this city, we all want those houses with the woods right in our backyard, right? And when we're doing that, then you have to think about the habitats that you're living right next to. So you might have some more of those mice in your backyard or a wood pile where they live, and then those mice would bring in ticks as well.
And when we talk about ticks and Lyme disease, not all ticks carry Lyme disease, correct?
Correct.
Yes. Tell me about the type of tick that carries Lyme disease, and if you can, where are those ticks found in Erie County?
Sure. So right behind you, actually, there's 3 types of ticks that are found in Erie County. The top one is the black-legged or the deer tick, and those are the most common tick that we're finding in Erie County. The adult, while it's bigger size there, is the size of a sesame seed.
Very, very small.
Very, very small. The other ticks are a slightly bigger, the dog tick or the Lone Star tick. And all of these ticks are carrying different tick-borne illnesses, but Lyme disease is by far the most common, and that can only be carried by the deer tick, that top reddish tick there.
Now, deer ticks, and I've been fortunate to do stories for the Erie Times News for many years about Lyme disease and ticks, and I've kind of talked with different folks, including Breanna here at the health department, about the migration of ticks. Originally, deer ticks affected with Lyme disease were only found in one location here in Erie County, correct?
I believe so.
Pretty much on the peninsula at Presque Isle State Park. Where can they be found now, infected deer ticks?
Right, so researchers are finding ticks throughout the county that are carrying Lyme disease. So not just on Presque Isle, but all the way out to Lake City, Girard area. I get ticks sent in all the time from Crawford County, from Northeast area. They're pretty much everywhere.
Okay.
Anywhere that you can find. They're usually in leaf litter and brushy areas where the forest would meet a field, or on the sides of trails where it's a little overgrown. Ticks could be in that location.
So Presque Isle is a perfect habitat because of the trails, not necessarily the multi-purpose trail, which is paved and is quite wide, but the hiking trails at the peninsula are just a perfect home because you brush up almost your entire weight of your walk up against the trees and, like you said, the leaf litter.
Right.
What do the ticks do? I mean, we've had comments about that they jump at you. How do ticks go from being on a twig or a leaf to being on your body?
Sure. So one really important thing to remember is that ticks are always crawling up. So they hang out kind of in that leaf litter. It gets a little warmer, like this weekend, over 40 degrees. And the ticks will begin to quest for their meal. So what they do is they just stick out their 2 little arms and wait on the edge of a blade of grass or a piece of brush until something walks by, and they would just latch right on, climb up your pant leg or your shoelace, and until they could find a place to bite.
So they hang on. They have 8 legs.
They do.
Because officially they're not an insect, right? They're an arachnid?
Right, yeah, they're more
like a spider or even a scorpion. And a subtle difference, but I was told on one of my stories that they're not insects after, of course, I put in a story that they were insects. So they hang out there on a leaf or something with the 2, and they have like hooks or like something that helps latch on, and they just catch on and go for a ride.
Absolutely.
Okay. So that's a good point. I think we get into, obviously one way to avoid tick bites is to stay out of those areas. But it's getting harder and harder. People like to go in the woods. They want to hike along the trails at Presque Isle and elsewhere in the county. What steps can someone take to reduce their risk of getting a tick on them and having a tick bite?
Sure. So being aware that ticks are out. So we were just talking, we know that it's snowy outside today, but after this weekend, we got several ticks sent in to us, or phone calls of people that had tick bites. So knowing that they're out, they're active anytime it's above 40 degrees, but then just protecting yourself. So they make a couple kinds of repellent. The most common would be repellent with DEET, like Off or Cutter, any of those brands that you can spray right on your skin.
And it usually says on there that it has DEET, right?
Yes, yeah. There's another product too that's, it seems to be gaining in popularity, and the active ingredient is called Permethrin. And now that product you treat your clothing with. And I recently read a study that even just by treating your boots and your socks, you reduce the chance of tick bites by 70 to 80%. So that's pretty substantial, and it lasts through a few washes, that product, Permethrin. So you could spray your boots or your clothing and know that it's protected for a couple of washes or for a certain length of time.
So you don't have to keep applying it and keep applying it, but you can't put Permethrin on your skin directly, correct?
Right. It could cause a skin reaction. It could also affect animals if they get into it while it's wet. But once it's dry, then it's safe to wear and have on your skin.
Okay.
We have a question, and I hope I asked this right. I think this commenter is asking if your dog or cat picks up, if they can pick up ticks, and if you can get exposed that way, or like your pet. You know what I'm saying?
Sure. Yeah. So dogs are susceptible to Lyme disease. There is over-the-counter treatments to repel ticks or off of a dog, or they could have a treatment that if a tick bites, it would then kill the tick. There is also a Lyme vaccine for dogs, but cats don't seem to be affected by Lyme as well. Now, if a tick hitched a ride on your dog and came into your house, potentially if they didn't attach to the dog, they could bite the person at that point.
Sounds like the likelihood is less. I mean, as far as animals commonly found in the city, you talk about dogs and cats, but you talk about rabbits and skunks and raccoons and all of that stuff. Are deer ticks found on them very often?
I would suspect that they probably are, but I don't have.
It's
that
not really but it's not a way that most people get tick bites or get ticks on them by going to where the fields meet the woods,
right,
and a direct exposure from a tick looking to find a host, brushing up against the leaf or the branches, and them attaching to you that way. That's the most common way.
Yeah, and the most common ages of tick bites are young children or like middle-aged adults. So people that are outside enjoying, children are always on the ground running around, and success is more likely to get bit.
Well, you're out there in the field.
Okay, we got another question.
Okay.
Holly says, talk about untreated Lyme disease, and do doctors take it seriously? I know that you can't really, again, you're not a doctor, but
right,
I mean, what happens if you...
Well, certainly, and again, I'm gonna have a conversation with a physician tomorrow on this. I've talked with, and Breanna, jump in too as well on this. They are taking this seriously. The doctors that I have talked to about this are also of split opinion on whether there is actually more infections going on or whether it's just better diagnosed. I know there is a lot of talk online about treatments for chronic Lyme disease. I will address that with a physician tomorrow. But a blanket statement, yes, physicians I've talked to are taking Lyme disease seriously. They realize it's hard to argue with the numbers. There are more people in Erie County being diagnosed with Lyme disease, point blank. I mean, the health department has those numbers, right?
Absolutely.
It has gone up from about 20 cases a year. The last 2 years, it's been 140, I think, last year, and 180 the year before. So the numbers have gone up quite a bit.
They have, yes.
So.
Yeah, the numbers keep increasing. The doctors, as they're coming through school now, are getting trained to diagnose and treat Lyme disease. whereas you mentioned it's not that old of a disease. It's still relatively, within the past 30 years or so, we've started to see it here. But the ticks that carry it now, they are in every county in Pennsylvania. So the Pennsylvania Department of Health has also is also trying to push more out to both individuals and physicians.
It's an education. I mean, and I know you have some things here that talk a little bit about the importance of letting even kids know about ticks. Breanna, is there something you can show us a little bit about what you guys are doing to help teach young people about ticks and Lyme disease?
Absolutely. So as the health department, we were lucky to get a grant a couple of years ago, and what we did with that was that we printed tick identification guides, which show those 3 types of ticks in Erie County, as well as some prevention tips and how to remove a tick on the back. We've worked to put those out in
I'll show this a little bit closer.
Oh yeah, we've worked to distribute those to different stores, household garden stores. Schools are getting those, scout groups or any kind of outreach that we're doing are getting those. We also have a little bit longer brochure we put together about Lyme disease in Erie County, and where are you finding the ticks, what are the symptoms or locations. But we also have some really cool games that sometimes teachers or scout groups, church groups might want to use with their kids, and so those are always available for us too. We have a Lyme disease bingo that was developed by the Pennsylvania Department of Health, and also a Lyme disease matching game that just goes through some different questions that also then help to teach about the ticks.
What's the message you're trying to get through to the kids through these games? Is it to identify ticks, to know when there's a tick on their body? What's kind of the most important part about what you're trying to teach kids?
Sure. So the most important thing is just, again, to be aware. So if you're bit by a tick, that you know it's a tick, you know to remove it quickly and the right way.
Let's get into that. This is a perfect time to get into that. I know there's a question online, and we'll get to that in a second. But let's talk about it. And I know you have some tweezers here. Mm-hmm. There's a whole sorts of home remedies, what to do if you find a tick. But let's start with the basics. You've been out walking in the woods.
Yes.
You take off your hiking clothes, and you find a tick.
Yes. And
the tick is feeding. It doesn't just swipe off. You can't just knock it off. The tick is attached.
Right.
What do you do?
Sure. So you would want to take a pair of fine tip tweezers and just put them as close to the skin as possible, right on the head of that tick. So if you can see here, you want to get it right on the head of it and just pull it straight out. There are a lot of remedies. I remember when I was a kid, people said to light a match by it and it would come right out.
Covered in Vaseline. There's a bunch of them. Are any of those actually a good idea?
No. If the tick is carrying a bacteria, they carry it in their gut, and so you don't want to agitate it to get it to the point where it might transfer that bacteria to you while you're trying to remove it.
Okay.
So just those tweezers, swift, easy, pull it out.
Make sure you get the whole tick. You don't want to leave the head of the tick in there. Right. You want to get it, and then is it just a what kind of pulling action should you do on it?
I've seen it described the best as firm but gentle. So,
okay.
So that's not the most the best description, I guess.
But it's accurate for how you want to do it.
Yes.
What should you do with the tick once you've removed it?
Once you've removed a tick, if you would like to, you could bring it down to me for identification. I would ask that it could be in like a Ziploc bag or a small container, preferably not wrapped in tape. And then I would identify it for you to let you know what type of tick it is and if it has become engorged or not. So as it has been feeding on you for up to a few days, then they really grow in size. So I would let you know if it's engorged and how that risk would increase at that point, so that then you could better have a conversation with your doctor.
Should you, if you find a tick that has been feeding on you, and let's say you take it to the health department and it's a deer tick, at that point, should you at least call your family physician at that point to get some advice on what to do?
Sure. Every person has a different medical history, different immune system, right? So your doctor would know you best. So a lot of doctors in our area are aware of the risk of tick bites and Lyme in our area. So they all have, and they're also aware of your medical history. So it's worth at least a phone call to the doctor.
Okay, excellent.
We've got a good question.
Okay, excellent.
Besides Lyme disease, and I don't know if you're familiar with this, is there other tick-borne illnesses that people should be aware of or should be wary of if they, this kind of fits in with the conversation there. Like, if you do pull a tick off and you don't think you have Lyme disease, you're not presenting any of the symptoms, are there other illnesses to be aware of?
There are. The deer tick can also carry anaplasmosis or babesiosis. From the research studies that I've seen in our area, those are much less likely to be present. However, there is still a risk. The dog ticks and Lone Star ticks can also carry other illnesses. The Lone Star tick, recently, there's been evidence that it can trigger a red meat allergy, which nobody wants that, right?
That would be horrible.
So those ticks are seen a little less common in our area, which would make me think that that allergy is even less common in our area. But a lot of those tick-borne illnesses are presenting pretty similar to Lyme disease. So again, those flu-like symptoms, they come with different types of rashes.
Excuse me.
And a lot more information about those diseases could be found on the CDC website.
Okay. We talked earlier about avoiding tick bite, reducing your risk of getting a tick bite. Mm-hmm. Obviously, we're not proposing avoid the woods altogether.
No.
What are some things that you can do? We talked a little bit about the permethrin and the DEET. I don't know if we got much into the clothing. Mm-hmm. What can you do? What do you recommend that a person should wear, and how should they wear their clothes if they want to go hiking? Let's say they want to go hiking on some of the trails at Presque Isle. Sure. What should they do clothing-wise to reduce the risk of a tick bite?
Sure. So light-colored clothing is always helpful so that you're better able to see the ticks. You could also take preventative measures by tucking your pants into your socks and maybe even taping your socks up around your pants, just so that there's no little entry points for those ticks to get into.
Because you said they like to climb up.
They do like to climb up, absolutely. Long pants and long sleeves would be the most recommended. However, we do get summer here, so not always the most practical, I guess.
No, it's not, but it's interesting. I was able to talk with Ray from DCNR at the Tom Ridge Environmental Center earlier today, and he mentioned it's a new statewide rule for park rangers that they're not allowed to wear shorts in the summer, and one of the main reasons is to reduce the risk of tick bites. So no matter how hot it gets, and yes, it eventually will get hot here, not today. Park rangers are wearing long pants, and that's one of the reasons why. So it's interesting.
We've got somebody this is an interesting little thread we've got going on here, that somebody said, well, it's winter, so they're gone. Not true, right?
Not true.
Can you expand on that a little bit?
Yeah, so there are several studies showing that ticks can be active any day that it's above 40 degrees, but even though there's snow on the ground right now, they're not entirely dormant. They're just hiding out under that dark, damp leaf litter that we all left in our gardens or along the sides of the bluffs or woods. They're hanging out there. They're staying warm, plenty warm enough, and they'll be right back out again as soon as it's 40 degrees.
They don't hibernate. I mean, it's not really, and they don't go away. I mean, mosquitoes, we don't see them for 5-6 months out of the year. It's not the case with ticks.
That is not, no. I have people submit ticks to us for identification and on an entirely voluntary basis, but I have gotten a few ticks in February, a few ticks in March, and just yesterday I really saw an increase in the number of ticks and phone calls that I was getting.
So anytime the temperature gets decent, upper 30s, lower 40s, or anything more, they get more active.
Right. On those days that we're so eager to get outside, right? It was the first day of trout this weekend, or going to scope out your yard and see what you can start getting ready for the season.
They're hanging out, waiting for you with their two legs up in the air.
They are.
You have something here on the board we haven't touched on, is about creating a tick-free zone in your backyard. You mentioned earlier, Breanna, that there are ticks, especially if you have woods at the edge of your property. There's a good chance you have infected deer ticks lurking in there. Not to scare folks, but that's because they're found throughout the county. Mm-hmm. Tell me a little bit about what's on this and what can you do to reduce your risk of having infected deer ticks in your backyard so your kids can go and play and not have to worry too much about ticks.
Sure. So To keep your yard more free of ticks is to know, again, that ticks are looking for those dark, warm areas. So like that leaf litter right around the edge of your yard, it says to keep your yard raked, free from those leaves. If your yard does go right up against the woods too, what is recommended is putting a barrier there of a barrier of stone or of cedar chips, something, because what would kill ticks is that dry heat.
Okay.
So also going with that, maybe that barrier, and then anywhere that you're sitting in your yard or have a play set for your children or a patio set, you would want those to be in the middle of your yard where the grass is kept short and trimmed so that the ticks don't stand much of a chance there on a 90-degree July day.
Okay. Is there any recommendation of using any sprays or anything like that?
They do make products like that, but it can be harmful to other insects in the area as well. So I would recommend consulting an exterminator for that or your local garden store.
Okay. We've covered quite a bit. We're almost at the end of the half hour.
Right.
Are there any other questions from folks on Facebook?
Somebody was saying something about checking dogs for ticks. Like, say your dog is out, should you make it a habit to check your dog for ticks when they come inside?
Yes,
okay.
Yeah, absolutely. Dogs are a little bit harder because they're a little bit more hairy, but they do make other tick pulling products for dogs, similar to like this tick twister. It would just slide right under the tick's mouth to remove the tick from the dog.
Okay. I know there was one that I had written down, I just saw, that the question I've gotten from a lot of folks is, well, are there ticks all throughout the peninsula? Should I be concerned if I'm taking my kids to the beach or if I want to use the multi-purpose trail? Should you be concerned about going to those areas of the peninsula?
You should be concerned about going to areas all throughout the county.
Mm-hmm.
They would not be on the sand in the beach, but they could be on any of the brush or where the leaf litter is hanging out, or where the leaf litter is throughout the county and those brushy areas.
Okay, and the multi-purpose trail is the same as any other trail. It's just a wider paved trail. So if you walk in the middle where you see all those folks, you're probably fine. But if you're brushing up, especially when the trail winds its way through the woods,
right,
they could be there.
There would be the potential for ticks. Yes.
All right. Well,
One additional
one more question.
If somebody has a tick, do they need to make an appointment with you, or can they call you, or like?
No, if you've been bit by a tick and you want to bring it here for identification, we don't do any testing, but we do identification, and they can drop it off. If I'm here, I'm happy to meet with them, but I am a field inspector, so I'm not always here. We do try to get that identification back within 24 to 48 hours to that person.
All right. Breanna, thank you very much for participating in this. Thank you for watching, and this will be available on goerie.com and also on our Facebook page. Again, I'm David Bruce from the Erie Times News, and thanks to Sarah Grabsky, also from the Erie Times News and goerie.com, for all her help. Thanks again.